Hey guys, this is Dr. Moore with Cumberland Chiropractic and Sports Medicine. Today I'm going to be talking to you about a case of plantar fasciitis. So when people think of plantar fasciitis, they don't typically think of chiropractors fixing that. But this person's foot pain was not only a foot problem, it was also a leg problem and a low back problem. So we had to kind of look at all of those things and fix those in order to address her foot pain. So I'm going to tell you how we did that in today's video. Stick around. So let me tell you about this case. A woman comes into our office. She has had foot pain for about 5 to 6 years, okay? It's been getting progressively worse. It's at the point now where she hates getting up in the morning because the foot pain is terrible when she hits the ground. She can't, stand in her own shower. She's got to wear flip-flops. It's that kind of pain. It's been getting progressively worse. Over the 5 to 6 years, she's seen a orthopedist about her foot pain. He's diagnosed her with plantar fasciitis. They tried some injections, didn't get a whole lot of results. So let's talk about plantar fasciitis. What is plantar fasciitis? The plantar fascia, so if you can see here, this is the bottom of the foot. Here are the bones of the foot. Picture a few muscles running on both the bottom and the front. The plantar fascia is a web of tendon-like tissue that runs from the heel to the toes, right? When an inflammation happens here, you start to get pain every time this tendon at the bottom of the foot has to extend or gets pulled on, and that happens every time you step with the foot, you put pressure on the foot. It's been getting progressively worse for 5 to 6 years. It started gradually, and when it started to get worse, she started to change the way that she walks because it hurts. So what's she doing? She is keeping her foot shortened and she's rolling to the outside of her foot, right? She's trying to put as little pressure as possible on that plantar fascia. She does that long enough and it starts to change the way that her ankle works, right? She doesn't want to bend her ankle when she leans into that step. So this starts to get stiff, her calf starts to get tight, and eventually it works all the way up to she's putting less pressure on one foot because one foot hurts worse than the other, and she starts to develop low back pain because she's walking in this altered gait for years. So that's where I find her. She comes in and that's what she's talking about. She's got bilateral foot pain, and she's got back pain. Okay, so what's the treatment for this case? As I just told you, there were several components to this person's problem. She's got a foot issue, foot pain. She's got some ankle. She's lost mobility in her ankle. And she's also got something going on at her pelvis. So she's been distributing weight unequally for years now, and she's got a shift at her pelvis that's contributing to her problem. So what do? We start at her foot, and we start with doing a combination of manual soft tissue work. So I get in here with my hands, I find what's tight, and we start to do a little bit of loosening to increase that mobility at the bottom of the foot, and then we do some instrument assisted soft tissue work. So this is a stainless steel beveled edge tool that I use to scrape across the plantar fascia and break up some of those tight adhesions that have formed in that plantar fascia. And next we encourage some ankle mobility with some chiropractic adjusting and some muscle work to her calves. And then we do some chiropractic adjusting to her hips to restore that equal weight distribution at her hips, change something about the way that she's walking. So that's cool, right? I think that's probably the coolest part about what we do in our office is we take a big picture look at what's going on with somebody. If she'd gone to a back specialist, they would have looked at her back, ignored her feet. If she'd gone to a foot specialist, maybe give her some new shoes, some injections, but it wouldn't have changed a thing about the way that she walks. Probably wouldn't have gotten her these long-term results that she'd had. So that's cool about what we do. Worked with this patient. Within 2 visits, she could tell that we were getting some results. She wasn't hating waking up in the morning and getting up out of bed, wasn't going to lean on her furniture, and at the end of 2 weeks, she was able to tell me, I can stand in my shower now. I don't need my shower flip-flop. So that was really cool about this case. Okay, so this has been a cool case of treating plantar fasciitis, a seemingly simple condition with a complex cause. If you have a complex condition and you need some help, give us a call. We'd love to help you with it. If you have a question or comment, please leave it with the video. And if you know somebody who needs to see this video, please share it with them. This has been Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we get you better faster.